In this video, we are gonna see about RadioImmunoAssay by Dr. G. Gayathri, Associate Professor, Microbiology, Vistas. RadioImmunoAssay is one of the sensitive immunoassay techniques which helps in the determination of antigens or antibodies in a sample with the use of radioisotopes. It is an in vitro type of antigen-antibody interaction, when radioisotopes instead of enzymes are used as labels to be conjugated with antigens or antibodies. The technique of detection of the antigen-antibody complex is called RadioImmunoAssay. RadioImmunoAssay is an in vitro assay that measures the presence of an antigen with very high sensitivity. RIA was first described in 1996 for the measurement of endogenous plasma insulin by Solomon Burson and Rosalind Y. Lowe of the Veterans Administration Hospital in New York. The Veterans Administration Hospital in New York. The classical RIA methods are based on the principle of competitive binding. In this method, an unlabeled antigen competes with a radiolabeled antigen for binding to an antibody with the appropriate specificity. Thus, when mixtures of radiolabeled and unlabeled antigen are incubated with the corresponding antibody, the amount of free not bound to antibody radiolabeled antigen is directly proportional to the quantity of unlabeled antigen in the mixture. Principle: antigens and antibodies bind specifically to form the EGOV complex. The antigen can be labeled or conjugated with radioisotopes. The unlabeled antigens from the sample compete with radiolabeled antigens to bind on paratopes of specific antibodies. The unlabeled antigens replace labeled antigens that are already linked with the antibodies. The unlabeled antigens, when bind with antibodies, increases the amount of free radiolabeled antigens in the solution. Hence, the concentration of free labeled antigens is directly proportional to the bound unlabeled antigens. It involves a combination of three principles. 1. An immune reaction, that is antigen, antibody binding. 2. A competitive binding or competitive displacement reaction. It gives specificity. 3. Measurement of radio emission. ALT gives sensitivity. RadioImmunoAssay RIA applications. It was first used for the detection of peptide, hormones, detection of different viral antigens, detection of many hormones and drugs, detection of hepatitis B surface antigens, detection of mycotoxins, detection of early stage of cancer. RadioImmunoAssay advantages: high specificity, high sensitivity, can detect a very small amount nanograms of antigen or antibodies. RadioImmunoAssay limitations: working with radioactive substances makes it a bit risky. Disposal of radioactive substances can be problematic. Equipment and reagents are expensive. Radiolabeled substances used have a short shelf life.